You are watching the Doctalk show.
So now we want to find out whether diabetic eye disease can be treated. If someone has diabetes and they start to experience problems with their eye, what can be done to cure this condition? So, Dr. May, in your experience as the eye surgeon, can this condition of diabetic eye disease, the retina, when it destroys the retina, is there any way it can be treated?
The first thing that should be done is to have continuous screening and early detection for the diabetic eye disease. And when someone comes early, actually they get better outcomes in their vision than when they come when it's already too late. When they have lost much of their vision, they will not recover much.
So it is important to catch it early.
Very early.
By screening.
Yes.
How can when should one now start screening for these eye diseases?
As soon as one knows, as soon as you know that you have diabetes. If they have measured you for diabetes today, go for eye checkup. That is how soon it should be.
So for the people who have diabetes, how often should they now screen for the eye disease? Would it be like every week?
As earlier said, if the patient has diabetes, the first thing is to come for an eye checkup. Then depending on what we find as eye doctors, we would give you a schedule. And if at that point when the patient has checked their eyes and they don't have any diabetic eye disease, the next routine checkup for the eye would be after a year. But if we find at some stage we ask them to come back after 6 months. At another stage, if there is much damage, they will come back after, they will get the treatment. They will need to get the treatment and then get a schedule. Yes, and then get a schedule.
So it depends on the stage of the disease. Yes. Okay, so now talking about the actual treatment. What treatment is available and where can one access it?
Standard treatment for patients who have diabetic retinopathy or diabetes affecting the retina is laser. Laser is a certain form of treatment we do by welding or burning, trying to close those blood vessels that are bleeding or oozing. We use a technology, a certain machine delivers some light, which is hot on that retina, and then it seals off those bleeding blood vessels.
Okay.
So that is why we encourage that when we see early, we seal that area that is bleeding and it stops.
Okay. And it's available at
and this treatment is available in Mengo Eye Hospital. We have the machine and we have the experienced doctors who can offer the services. This treatment can be accessed in Mulago National Hospital. This treatment can be accessed in some clinics around Kampala, like in
that focus on the eye.
And the eye.
That treat the eye.
That focus on the eye.
So it is the main treatment for the diabetic eye disease.
Yes.
For the early stages.
Yes.
And you said it is available. Is it affordable as well?
Yeah, and that's why we say that the earlier you come, the treatment is cheaper. This is available and affordable. Okay. And it doesn't require to be admitted in the hospital.
It also doesn't require the removing the eye, the surgeries.
We do all this work when your eye is inside. What we do, we apply some medicine to make sure that you don't feel pain when we are doing it. And after the treatment, we allow you go home.
Okay.
Yes, please.
And does it have good outcomes? Is the vision restored if we use this laser treatment?
You do realize that we are doing repairs. If it was a small place where we have welded, you remain with your good vision. If the place was very big, that means we have burnt most of the places, then you remain with some little. But at least we have hope that you don't go blind.
So if we catch it early,
yes,
you might save your vision.
Yes.
The problem is if it's now too late and the vision is already lost, you may not recover much of the lost vision.
Yeah.
Yes.
Okay. So apart from the laser therapy, it seems to be a very good technology. Could there be other ways to control it? If someone is now scared that the light is going to burn their eye.
You will give an injection into the eye itself. And this injection, like the way we've been saying, that these blood vessels, they have ruptured, they have opened, and they are leaking. So the injection which we give helps to reduce the swelling of this of the retina. And also what we should know is that the injection is a little bit more expensive than the laser, but it's available. And it's available in the hospitals that we're talking about. And if it's given in its proper and right doses, the swelling reduces and the patient is able to recover at least some more vision from what they had previously.
So it can help to also stop the bleeding blood vessels.
Yes.
Is it as effective as a laser therapy?
It's
It's more in the advanced stages. You don't use it in the early.
No, sometimes if there is the vessels, the big vessels of the retina have ruptured and they have brought blood into the eye, then we first have to give the injections, and then after the blood has cleared, then we go back to the laser.
Okay, so it's kind of used concurrently.
The two
The
treatments.
challenge with the injection is that it is short-lived. When you give the injection, it works for about a month. You'll need to put another one. Then after a month, you'll need to put another one. So, but laser, when you have done it well, it is finished and permanent.
Okay. Yes. So that laser treatment and the injection,
Yes.
were the options available to treat the eye disease? Could there be any other apart from those?
Yes, in situations whereby you have given laser, you have given injection, but still there is further bleeding, or the blood which entered into the eye is still there, it has not cleared. So the other alternative is to go in and remove the blood, clear the healing fibers. You know, when there is blood everywhere, there will always be fibrosis, tissues come up.
They're like scarring, eh?
Scarring, yes. So we go into the eye by surgery method, and we clear all those fibers, membranes, and blood. And sometimes the retina, which we are talking of, may be off the wall of the eye. We have to go and put it back on the wall of the eye.
It's kind of like detached.
Detached retina, so we put back the retina.
And these surgeries can be done in Uganda?
This surgery is available and can be done. We have our own vitreoretinal surgeon who can do these services in the country.
Yeah, if we can catch the diabetes, we slow it down much earlier, you can slow the disease progression, and you can save yourself a lot of time and a lot of money.
Yeah, and it's very frustrating, doctor, to be blind. You know, you've been seeing today, and then the following month you are blind, you're being held with a stick. It's really very frustrating.
It is a physical disability.
Yeah, very frustrating.
And yes, you can't really do much about it. So remember, get your eye checked and get your blood sugars checked. So after the break, we're now going to learn exactly how we can prevent. Okay, we'll focus a lot on treatment. It's good to know the treatments are available, but how can we save ourselves from getting to the stage of the treatment in the first place? So remember not to go away. You can always send in your questions and comments on our social media platforms, Facebook, Twitter, and you can also subscribe onto our YouTube page on the internet. Don't go away.
You are watching the Doctalk Show.